Hi, it's Dr. Sweeney here. I'm going to talk about abdominal pain today as a guide to people that are having trouble, particularly with upper abdominal pain, is tonight's topic. Now, I'm just going to describe some groups of symptoms that can point towards certain pathologies, certain diseases. Now, upper abdominal pain, if we use your umbilicus, your belly button as a reference point, it's really discomfort above that point. So starting off in the upper left corner of your tummy, that is where the stomach lies. And so people can sometimes have a general ache, a discomfort, a burning, often made worse by eating or sometimes relieved by eating, which can track into the center epigastrium, that's the upper central part of the abdomen, and radiate up into the chest. Now, these symptoms are typical of acid reflux or gastritis, which is inflammation of the stomach itself. And these symptoms can track up. They can be associated with acid reflux. When the discomfort comes up into the chest, that could be esophagitis, which is when the esophagus, the gullet itself, is burned or irritated. So upper, central and left abdominal discomfort, burning, sometimes affected by eating, can be linked to acid reflux, peptic or gastric ulceration, gastritis. Moving more centrally in the epigastrium, the center upper part of the tummy again, you can get a gripping sensation which can come on in spasms, sometimes triggered by eating, centrally and more to the upper right quadrant of the abdomen, the upper right corner. That can be linked in with what we call biliary colic or gallstones. As I said, typically triggered by eating fatty foods. It causes a gripping or colicky sensation and often then can radiate through to the back as well. So that can be triggered by biliary colic or some kind of gallbladder pathology. The gallbladder is a small pouch which sits under the liver. The liver again is in that upper right quadrant, upper right corner of the abdomen. Centrally, in the center upper part of the abdomen, if people have a discomfort, an aching or gnawing sensation, sometimes eased by leaning forwards, that can be a sign of something called pancreatitis. Your pancreas is a gland which sits, an organ which sits in the center upper part of the tummy. It produces a lot of digestive juices, insulin as well. And when this is inflamed, a condition called pancreatitis, this can cause a central discomfort radiating through to the back through from the top to the back of the abdomen and into your back itself, and is relieved often by leaning forwards. Now, as I said, these are symptoms of pancreatitis, inflammation of the pancreas itself. So there can be a lot of issues which can occur in the upper abdomen. The timing, the location of these symptoms can point towards different pathologies. The bottom line is, if you are suffering with ongoing upper abdominal discomfort, whatever the pattern, please always go and check in with a healthcare expert just to have things investigated with blood tests, different types of imaging, to understand what it is that's causing these symptoms and to get to the bottom and to get to the right treatment. Hopefully that's been helpful in terms of just giving you a bit of an insight into some of the symptoms that doctors look for when a patient presents, and it might guide you towards the next level of getting help. Until next time, see you later.